I am Barbie Harden Hall. I am the Democratic candidate here in Congressional District 11, which covers Sumter, Lake, Orange, and Polk counties. And I do not have a primary challenge, so I am all the way through to the general election in November. And again, just happy to be here with you all and for that wonderful introduction. So the idea of Medicare for all or a one-payer system, it used to be an extreme idea in politics. It was something that was not talked about. You didn't sign on to it because it was almost like you were so extreme, you were so far out there, you just didn't need to be in Congress. But the good news is this is no longer being seen as an extreme idea. This is something that Americans have begun to realize that we are the only westernized country that does not have adequate health insurance coverage. We're the only one that's being crippled by medical debt. And although slower than we would like, people are believing that we should not be paying billions of dollars into a healthcare system that not only is ineffective, but it is causing widespread financial harm, which Candy touched on at the very beginning with her slides. It's no longer an extreme to believe that people should have a healthcare system that puts the people's needs, their lives, and their health over the profit of powerful corporations. And like many Americans, it unfortunately took my own personal experience with the healthcare industry to truly see how broken our system has become and the steps that we really have to take and have to take soon because people are truly suffering as a result of this broken system. As was already said, 3 years ago, my healthy and happy 20-month-old son, Everett, suddenly stopped walking. We were recommended MRIs, blood work, genetic testing, just running the gamut of trying to figure out what his diagnosis was, what was wrong with him. But we also were told that we would all have to make decisions on cost, and it would be very expensive to do these testing, and would it be worth it to us? Whether we would want to have to pay that financial cost to see what was going on. And genetic testing, which would be the testing that ultimately diagnosed him, was the one that we were probably talked out of or attempted to talk out of the most because of the cost of it. And it wasn't a guarantee that it would actually show something. But unfortunately, the genetic testing did come back and that he was diagnosed with metachromatic leukodystrophy. Most people with a rare disease, it takes them approximately 6 years to get a diagnosis. We got one in about 6 months. And again, a lot of that diagnostic odyssey is what they call it, is just because some doctors want to try all the simple little things that take forever because of the cost and because of that financial hardship that can be caused, and you don't necessarily are guaranteed to get the answers, which again, that should not be playing a role into how our health and our lives are being determined as far as treatment go. So MLD is a rare genetic condition that mostly affects children. And as was already said, it's a fatal condition. At the time, which was about 3 years ago now, it did not have an approved treatment in the US. And it is most often compared to a diagnosis of ALS and dementia, but it typically occurs in children at the age of 2. So my son was given approximately 5 years to live, but as was already said, he passed away 6 months later due to complications from his transplant that we had done in Pittsburgh in hopes of slowing down the progression of the disease. Through our situation, I've heard the stories of children and families with MLD and other rare diseases that were unable to get proper treatment and medical equipment. Their insurance companies are telling them that the prescribed items are not medically necessary, or that their child is not sick enough to warrant treatment or specific type of equipment. Children that have been given a fatal diagnosis with only years to live are not considered sick enough for insurance companies. Children that are progressively losing all of their abilities to walk, then to stand, hold themselves up, use their arms, talk, eat, swallow. They require 24-hour care, and they're not considered sick enough for insurance companies. Parents are currently spending precious time fighting with insurance companies and providers over treatment and equipment, time that is already limited with their child still with them. And now we are seeing hundreds of thousands of children losing Medicaid coverage in Florida because of political games. We can no longer allow politics and profits to outweigh people. Our health and our lives deserve better than being weighed against a bottom line. And it's for these reasons, all of these reasons, my own experience, the experience of the families that have diagnoses and children suffering from what my son did. It's why I support, and if I'm elected to Congress, or when I'm elected to Congress, I will co-sponsor HR 3421, the Medicare for All Act, because it's something that is personally important to me, and I've unfortunately seen the effects of it and seen the tragic consequences it can have for not only everybody, but most especially children. Thank you.